Hi, can you hear me?
Yes, now we can. You were frozen for a
Okay,
bit.
I think. Oh, okay. All right. Again, so I'll do this again. Hello and welcome everybody. Welcome to this episode on of our wellness series. Today we will be talking about weight loss surgery. But before we go into the topics, I'll give you a little bit, brief about what Fuchsia is, and then I'll tell you a little bit about our guest, which is Dr. Bhasker. And then, let's delve into the topic. So, Fuchsia is a women's networking community and a global talent showcase platform. We started off as a writing club, and as of now, we welcome all forms of creative expression. So, if you go to our website right now, you'll see people, showcasing music, art, fine arts, dance, photography, all kinds of things. I mean, things I wasn't even aware of, you'll find them on the website. And the kind of work we have been doing makes meaning in all of our lives, in the sense that we have seen people who have gotten jobs, people who have been published because they got a safe platform, and having a space like this can make a lot of difference. As we move forward, we want to make sure that Fuchsia is a place which is equated with happiness for women, and we are doing this via promoting learning and education. We also have a lot of campaigns and contests going on, some really exciting ones that you might want to check out. We are also making sure that we build meaningful friendships and relationships and networks as more and more people become a part of this community. We are working towards financial independence for you. And of course, we're working towards wellness, of which this episode is also a part. I am here again with Dr. Aparna Bhasker. And I was just saying this before the session as well with my family, that it's always, always a huge pleasure, Dr. Bhasker, to be here with you. It's a privilege to have these conversations. And I have learned so much in the process, not just about obesity, but also about, what the medical community, how the medical community is working, and all the different kinds of things that you have brought out on this platform. So, Dr. Bhasker, I welcome you wholeheartedly, and it is such an honor to have you here again with us.
Thank you so much, Anjali. And I must tell you that I enjoy these sessions and really look forward to, just having these conversations with you as well. So it's been a pleasure, and it's always an honor to be here.
Yay, thank you so much. Now, just to tell you a little bit about Dr. Bhasker, she is famous in the surgery world. She is a bariatric and advanced laparoscopic surgeon with about 14, 15 years of experience. She's also one of the first surgeons in India to be accredited by the Surgical Review Corporation and Center of Excellence, in 2011. Not to mention that I think Dr. Bhasker has also been working towards advocacy when it comes to obesity. She has been constantly, despite her very busy schedule, she has been collaborating across different platforms in raising awareness about obesities, and her work has made a difference. We know that with Fuchsia, her work has made a difference. And again, it's such a pleasure to have you here, Dr. Bhasker. But Dr. Bhasker, before we move ahead, I think before we move to the topic of weight loss surgery, I would also, and I think all of us would agree over here, would love to know a little bit more about your journey as a bariatric surgeon, because I did check the statistics. First of all, female surgeons are very low in number in our country. And then in bariatric surgery, the number is even lower. So could you tell us, what prompted you to become a doctor? And then, what has your journey been like?
So I think, thank you so much, Anjali, first of all. And I think it was surgery that prompted me to become a doctor, because that was the goal always. I always wanted to be a surgeon. I don't know, I don't have any particular reason for that, but I just knew that I'll be good with my hands. And it always fascinated me that, this is one of the branches where you can actually lead to a cure. So surgery was my passion even before I joined MBBS. And I joined MBBS as a step to becoming a surgeon. And yes, there are very few women surgeons all across the world, not only in India. The ratio is very skewed in favor of men, especially in surgery and orthopedics. But I think I was very fortunate that I had a very, very supporting family. So my parents were very supportive, and they never really brought us up like girls, So it was very neutral, and it was wide open. You could just choose whatever you wanted to do. And that was the first step. So there was no inhibition in my mind before entering into the surgical world. Also, I was very, very fortunate to have very supportive people in my department. So my my professors and my colleagues. Of course, when I entered into the department, there wasn't a single lady surgeon around. I mean, as a student, we had a teacher who was a lady, who was also an inspiration. But there wasn't any students. All of us, all of them were guys, and it was just me. So I think I did kind of encroach into their privacy a little bit, but they really welcomed me and they made me very comfortable. So I need to give it there. Yes, there are difficulties along the way. So I do remember that initially I used to get very upset because whenever I studied in a smaller place, and all these patients would come and they would call all the male surgeons as Dr. Saab. And I was the eternal sister, not to demean any, the nursing profession, but they just, it is in their minds and they don't mean it. But initially it did, lead to a little disappointment. Then I said, it's okay. It doesn't matter. Ultimately, it depends on the care and the amount of hard work that you put in. It just, people start respecting you. And even after 15 years, there are patients there who still remember me and come by my name. So I think that is a great feeling in itself. Yes, later on, I think there are issues with being a woman in a man's world. We need to work harder. There is no doubt about that. We also take longer. I think if you've read this book, Lean In by Sheryl Sandberg, I think every one of us will identify with that because we're just not vocal enough. We need to become a little bit more vocal. We need to start asking for things. So I know that as I became senior, I also taught people who were junior to me. And there were men and women both. So there were male surgeons as well as women surgeons. And the difference is stark. So women just don't ask for anything. They will just keep working and hoping that they will be, treated fairly. Unfortunately, the world today is not a fair world. So you have to open your mouth and ask for things, and it really makes a difference. We are not very good at financial, negotiations. We shy away from it. So it's not only about investments; it's also about seeking a job or asking for a certain amount of salary. I think it's common across professions. It's not only in medicine. So these are some examples where I think we ourselves need to become a little bit stronger. And rest, everything falls into place. So if you're good at what you do, I have never experienced from my patients that I am a female surgeon. Nobody has come and said, oh, you're a lady, so how will you operate? So that doesn't happen at all. So to a certain extent, it's in our own minds. Yes, there will be some problems because you're entering into a territory which is not treaded before. But I think it's a privilege to break barriers and to break the glass ceiling. I consider it a privilege.
That's
and
lovely.
It's not that difficult.
Honor to actually hear you say that. And you're very, very right about, us having to also speak up. I remember when I was in college, I was studying gender. I was told by my senior that you don't need to go away whenever, you see like a bunch of men sitting anywhere in the cafeteria, or you see them, sitting outside in the college, on the campus, anywhere. So what we usually would do was, if we saw people are sitting there, we would not claim that space. We would quietly, just like sneak away. So, and once we started doing that, it made a lot of difference in the way we felt about ourselves, in the way the student community viewed us. And I think these things can make a whole lot of difference. And thank you so much. Thank you so much, Dr. Bhasker.
Women tend to hide. I think there is no reason to hide. Also, just one last thing about it. I have always considered this as an advantage. So, there are many advantages to being a rarity. So it does work in your favor also to a very large extent. But yes, you do need to work really, really hard and be good at what you're doing. And that is non-negotiable.
Yep, absolutely. Now, moving on to our topic for today, we will be talking about all you need to know about weight loss surgery. And if you are here and you want to say a hi, please do drop a comment. I would love to know who all are watching. I cannot see that on StreamYard, so I would love to know if some of my teammates are here, if some of my friends are here, or if you're just somebody new and you want to say hi, do say hello. And now moving forward to the topic, and I know it is a slightly tricky topic, and which is why I wanted to take 2 minutes before we start questions to reflect on why we actually took this up and why we want to talk about obesity. One, it is to be sure that we are not promoting stigma. We are not going to reduce people to their obesity or to their disease or to their illness. We actually want to talk about obesity in the right manner, in a very responsible manner, and approach it with integrity, which is why we are doing this session on weight loss surgery. What usually does happen is whenever people talk about obesity in stigmatized terms, it not only stops people from seeking treatment, it also stops people from taking preventative care. So eventually it does more harm than it does good. It does no good anyway when you stigmatize people, when you shame them, or when you start this guilt cycle and start labeling people with obesity as lazy and without understanding what medical complexities lie behind it. Also, to also understand obesity in the context of the world that we are living in, it is not a very simple equation. We all work long hours. We also are, especially with work from home, we are also sitting a long time. um, Quality food, fresh food is difficult to find. It's also expensive. So all of these factors also contribute to someone's weight. They also contribute to what obesity is, which is why as we move forward, I will clearly refer to people who have obesity as people with obesity as opposed to obese people, to make sure that when we are talking about them, we make that distinction and that we approach it with compassion and with responsibility. And Dr. Bhasker agrees with me on this, and we're fortunate to have someone like her with us to discuss this. Now, moving forward, Dr. Bhasker, just to start with and get an idea of what weight loss surgery is and what are the different types, could you tell us a little bit more about this?
Definitely, Anjali. And before we actually address that, I completely agree with what you have said. And I do believe that obesity is something which should be treated at par with other medical conditions. I wouldn't even use the word disease. It should be treated like any other chronic condition. So if a person is suffering from diabetes or high blood pressure or say high cholesterol, heart problems, obesity is a part of that kind of disease spectrum. So it's a chronic condition which needs lifelong management. So coming to weight loss surgery, there are bariatric surgery is basically, it has been around for now many years. It was initially started in 1950s in the United States of America. And over a period of years, it's now almost, you can say 60 plus years that it has been around. And there have been a lot of developments, a lot of evolution in this field as well. Initially, it was started as open surgery, where they used to cut open the entire abdomen and then be able to do the surgery. But with the advent of minimal access surgery or keyhole or laparoscopic surgery, it's become much safer, to the extent that today, if we operate on a person today, tomorrow or day after, the person would go home, and 7 days later, they would be in office. So it has become as safe as that. Now, what do we mean by bariatric surgery per se? So it is actually, in medical language, I would say that it is a gastrointestinal surgery. So we need to differentiate it from plastic procedures like liposuction or say abdominoplasty, tummy tucks and things like that. That's a completely different specialty. Here, what we do is we make a change to the stomach and the intestines, primarily the small intestines. And usually in almost all bariatric surgeries, we reduce the size of the stomach surgically using staplers. And in some of them, like the bypass procedures, we would also reroute the small intestine. So there are many kinds of bariatric surgeries. There is something called as sleeve gastrectomy, something called as a Roux-en-Y gastric bypass. So there are 2 or 3 different varieties of gastric bypasses. Then we had something called as gastric banding, which was very popular almost a decade back. It's gone out of favor now, but it was a very popular procedure for a very long period of time. Then we have certain other procedures which are a little more malabsorptive. Nowadays, newer endoscopic procedures have also come in. So there are various types of surgeries available, but of course we have to tailor make the approach basis the patient's clinical profile. So who is suffering from which other problems and how much is the weight and what is the patient profile. It's a lot of things that are taken into account before we actually reach to a decision about the surgical procedure. So that is how it is done.
Okay, I was speaking on mute again. Thank you so much, Dr. Bhasker, for this. I actually had no idea that, liposuction and, bariatric surgery are 2 different categories altogether. Yes. And this was a question that I did have. So thank you so much for clarifying it. Now, because these are 2 different and bariatric surgery can also be medically necessary. So when does it become necessary to do a surgery like this? What qualifies somebody, to get surgery done?
Yes. So, see, there are multiple qualifying criteria that are used when we consult somebody for bariatric surgery. One of these criteria is the body mass index, which we've discussed in one of our previous sessions, the way we define obesity. So, anybody who is coming in the category of, say, grade 3 obesity and above, which is a BMI of 37.5 and more than that in the Asian context. So those are people who would be eligible for surgery. In fact, as per the Obesity Surgery Society of India, the BMI category is actually 35 and above. So anyone with a BMI of 35 and above can avail the benefit of surgery. Then if the BMI is above 30 and the person is also suffering from, say, two other obesity-related problems, say like diabetes or a heart disease or, say, hypertension, so then again, these patients would become eligible for availing the benefit of surgery. Now, each patient is different. We would also see the age of the patient. We also take into account waist circumference, so abdominal obesity. So if a person is a diabetic and it's a male patient and the waist circumference is more than 90 centimeters, then they can also benefit from the surgery. If it's a female with a waist circumference of 80 centimeters and she's a diabetic, then she would also stand to get good results after bariatric surgery. But as I said, it's a very clinical decision. Each patient is different. We also take into account a lot of other factors like age, like food habits, like many other things, efforts which are made in the past. What was the result of those efforts? So all those things are taken into account, and then also whether the patient will be able to cope up with the post-operative requirements of the surgery. So that is also very important. So it's a mutually decided, mutual decision that patient and the doctor would take together.
Thank you so much for that, Dr. Bhasker. I also came across something called restrictive surgeries when I was doing my research for this live session. So could you tell us what they are and how they work and what are the possible risks which are associated with restrictive surgeries?
I think, first of all, I would like to say I'm very, very impressed with you and to go into so much detail. So that's really nice.
Thank you.
So yes, we have restrictive surgeries. Like I spoke about the gastric band. So this used to be a silicone band, which we used to place in the like an upper part of the stomach, which would divide the stomach into an hourglass kind of shape. So a smaller upper pouch and a lower, bigger pouch, and the band would be in between. And the band would have a connecting port, which we would place under the skin. And then we could inject fluid into it and tighten the band or loosen the band. So this was purely restrictive. So the more you tighten, the less you can eat. The more you loosen, the more you can eat. So that's how it works. That band actually is the only purely restrictive procedure. When we talk about sleeve gastrectomy, it is also, it could be termed as a restrictive procedure. Again, because we are reducing the size of the stomach only. And we make what we do is that we divide the stomach vertically and remove the outer 2/3 of the stomach out of the body. So what remains inside is something like a banana-shaped sleeve. Okay, so what happens is that the person can actually eat very little. So even if they eat, say, 3 to 4 spoons of rice, maybe in a month's time after surgery, they feel very full because there is no space there. So that's why these surgeries are called as restrictive, because they restrict a person from eating, and the other mechanisms are lesser as compared to the restriction that is being imposed.
Okay, so essentially what happens in restrictive surgery is that, the diet is controlled, the amount of food we are eating is controlled, right?
That is one of the mechanisms, but in a sleeve, it's not purely restrictive. So there are many hormonal changes that also happen after a sleeve gastrectomy. So maybe we can talk about them a little later.
Okay, definitely. Hi, Sarita and Fauzia, by the way. Thank you for saying hello. Okay, now moving on to what could be the possible risks, with this, because it does sound a little tricky. I'm sure you've done it 100 times, but what could be the possible risk associated with such kind of a surgery?
So before I get into the risk of the procedure per se, I would always like to say that even when you take, say, any medicine, even medicine as benign as, say, paracetamol, there would always be a side effect which is associated with it. In fact, when you talk about drugs, you would see a whole list of side effects, and it practically includes almost everything. Also, we need to weigh the pros and cons of the disease versus the side effects of the surgery. So if the disease is not controlled or left untreated, then it could lead to a lot more complications than any surgery would ever do. Thirdly, if a follow-up is done properly, and the patient and the doctor are regularly in touch, then many of the problems can be avoided. Coming to specific problems after surgery, number one is adjusting with food intake, less food intake, because food intake goes down. The beauty of bariatric surgery is that the cravings also go down proportionally. So people do not crave for food, they do not feel hungry after the surgery. And that in itself kind of brings the intake down. But sometimes mentally, if we are very dependent on food for comfort, then we need some adjustment time and a lot more counseling than this thing. Then other things could be that we are used to eating at a certain speed. And then after surgery, we need to eat slowly because the pouch is very small now and it can only accommodate that much. So if you eat too fast, or say you're busy with work and you're not focusing on eating, so mindful eating is very important after surgery. If you're not eating mindfully and you try to gobble your food down, it's going to get stuck and give you pain in the chest, or you may feel that the food is stuck, or there could be vomiting as well. But it all depends on how you're eating and how much you're eating, how well you're chewing your food and stuff. That is one thing. So, of course, these things usually settle down within 2 to 3 months. After this, nutritional supplementation is very important because, number one, we are changing the anatomy to some extent. We are also restricting the food intake. So it is very important to be careful about protein, iron, multivitamin, calcium, and all that. People who do not take these supplements and are not compliant with these supplementations, they tend to manifest with deficiency symptoms. So that becomes a long-term issue which can happen with surgery. So it's very important to be compliant with your nutritional supplementation. Third thing is some degree of hair fall. So hair fall is something which troubles everybody. Of course, if you're going to lose 30, 40, 50, 100 kilos of weight, some degree of hair fall is bound to happen, but it's temporary and it all comes back. As far as surgical complications per se are concerned, the risk of those would be less than 1%. They are related, they're the same as any other GI surgery that we do. And of course, if you are being operated at a good center by an experienced surgeon, the rate of complications will definitely be lower for you. And it also depends on the patient's profile. So if somebody is more high risk, somebody has too many comorbidities, uncontrolled diabetes, severe heart disease, or somebody is very big, say 200 kilos plus, BMI is very high, or older age. So these are again risk factors which may increase the risk of complications. But as of today, the risk of complications is comparable to a laparoscopic gallbladder surgery or say a knee replacement surgery. So it's absolutely safe.
Okay, all right. Okay, that's a lot of information to process, but I did most of it. I did understood a lot of it. Thank you so much for explaining it in such detail, and that too in terms that people can understand. Because I'm sure with the medical terms and everything, but you've been able to translate it so well. Thank you so much for it. But I just focus on something, which is you mentioned that there's also diet. There's also other things that happen after the surgery. So what do these changes sort of look like? Because I'm sure with the surgery also it takes a while for the weight to come down. And then how is it supported with diet and lifestyle changes to get the best result out?
So I'll go back to what I said right in the beginning, that this is a lifelong process. Once a patient comes in for bariatric surgery, then they are with us for life. And so diet is very, very important. And hence, I have always insisted that dietitians and nutritionists are an integral part of a bariatric team. Because as a surgeon, I can only do that much. I can operate, but I can't really provide all the support that is required. So we need to have a very good team. And I'm lucky to have two really good nutritionists with me. And because support is needed a lot more in the beginning. suddenly everything changes. So you're back to being a baby again. So you start with liquids again, then you go to semi-solid, you go to khichdi, and then finally you start eating again. And again, it's the quantity and everything is very, very less. At the same time, we don't want you to become nutritionally deficient. So it's a very fine balance that we need to strike, and that is helped by. You need to have really good nutritionists on your team, basically, who are not only good at what they do, but are also very patient and are very caring. So because imagine there's one person who's being flooded with so many queries from different patients. So I think it's good to have a mature team with us, and that really helps. Of course, the treatment is lifelong. Diet related stuff, nutritional supplementation, and also some degree of exercise is required post bariatric surgery as per each one's capacity. So because we do need to push them into some degree of activity to help maintain the weight.
Okay. I think you're getting a call.
Sorry, I'll mute.
That's okay. All right, I'll ask my question until then. I was wondering if you could tell us a little bit more about the differences between bariatric surgery and something, like liposuction. Um, I do have an idea, but how do they, differentiate on an operational level and on the level of how quickly they take effect and how lasting it is? So if you could shed some light on that.
Yes, so that's a very, very interesting question. I get this every day, actually. So liposuction is a plastic surgery procedure. It's a very what do you say, body part specific kind of a procedure. So you have say extra fat on your thigh, or you have some extra fat on your tummy or your arms, and you want it out and you want it to be in proper shape and all that. So then liposuction is good. Liposuction at the max can lead to say 6 to 8 liters of or kgs of weight loss. Whereas when we're talking about bariatric surgery, we're talking about anything between 30 to 100 kg or even more than that of weight loss. So people lose 100, 150 kilos and stuff like that. So that is the difference. So if you are more than say 30, 35 kgs from your ideal body weight, then lipo is not going to be helping you, right? But yes, if you have a little extra fat on your thigh or your tummy or your arms and you just want that to be out, then lipo is the procedure to go for. But if you're already 110, 130, 150 kilos, then liposuction will do nothing for you. Second thing is that liposuction is a superficial procedure, right? It's only meant for body contouring. Whereas bariatric surgery acts centrally. It not only will restrict your food, it will also act on your brain. It acts on your hormones. It changes a lot of things in your body. And it helps you to maintain that weight loss for a pretty long period of time. So yes, weight can come back again after a few years, but not to that extent. But lipo, if you do not follow stuff, 6 months, you will be back to where you were, right? So we are looking at a completely different patient profile for liposuction and for bariatric surgery. So it's like saying that you have BP, but you take drug for diabetes, so it doesn't work like that, right?
Okay. It makes complete sense. Yeah, and I think you put it very nicely in the sense that one is a cosmetic one and the other is actually medically necessary many times.
Yes.
I also remember, and this is an interesting tidbit, I was reading, again, I was doing my research, and I did see that you said for you, this is Bobo, by the way, you said that for you, surgery is like art. And I really liked it because you also mentioned that for you, it is not, patient surgery, solution, but you said for every patient, you have to approach it uniquely. You have to understand their unique requirements and then be in the operating room and approach it like art. And I think that is just amazing, the way, you sort of put it. And I also know you also love to paint. You are also a brilliant artist. If you actually follow Dr. Bhasker on LinkedIn, or I'm not sure of the Instagram profile, but I do follow her on LinkedIn. She posts her art there, and it's absolutely lovely. So I just wanted to mention this because I think it was beautiful. Now, moving forward to a little bit more about, the logistics of weight loss surgery. What could a typical procedure, cost, and is it covered by insurance or not? What does that look like for people?
So I think Typically, a weight loss procedure would start with, say, around 2.5 lakhs or so, depending on it depends on which which surgery is being done, which hospital it is at, and all that. But that's the minimum. And insurance, yes. So we have good news from insurance, and it's a very positive move that from October 2020, actually, the Insurance Regulatory Authority has said that bariatric surgery is being done for a disease, and its obesity should not be an exclusion from the insurance coverage, right? But right now, I think we are in the transit phase where things are yet to be streamlined, and hopefully in the next few months things will be much more clear and more streamlined, where most of the people who deserve a treatment will be able to avail the facility of insurance as well. So at the moment it's a little I think I could say that we're having some teething problems. So some people do get claims, some don't get claims, but it's much better than before.
And that's great. I think it's a great step ahead in the right direction.
Yes.
And I'm really glad that's happening. I didn't know that, it only happened so recently. It's surprising, but I'm just glad that it's finally heading to that place. Thank you again for this. Dr. Bhasker, now coming to our last question, and which is a very important one for me personally, which is about how does one create a community where we can have more open discussions about weight loss surgery. We can support people with obesity who are living with this condition. What are some of the things that we as a community, or maybe the family members of the person or the friends, and how do we create a support system? Because I'm sure you mentioned counseling, you mentioned nutrition. There's a lot of stakeholders there. I'm sure support is also one of those. So what are some of the steps that you have seen have worked out that we can take to make a difference?
So I think we discussed it last time, Anjali, and what I would say that support and sensitivity. I think the biggest problem with the treatment of obesity has been that we've somewhere not recognized it as a disease. But if you come into our clinic and you see that patients who are not able to breathe are breathing now. There are people with saturation levels of 60% and 70% while they're sleeping, which is so dangerous to their health, right? So these are people who go up to 94, 95%. There are patients with polio who are not able to walk or not able to stand, which they were before they put on weight. And we cannot blame them for putting on weight because they're not mobile that way. So these are patients, they lose weight and they're able to become independent again. Old people with knee replacement, with knee issues. And for every little thing, even for getting a glass of water or going to the washroom, they're dependent on people. And then they have surgery, they lose weight and they become independent and they start roaming around the world. So these are things which we really see on a day-to-day level. And also now what we are seeing is that families are becoming a little more supportive. So when it comes to, say, younger girls and women who are suffering from PCOS, and families have seen them put in all the effort and so much of this thing, and they've not been able to lose weight. So they are now becoming more open to it, which is a great step. We also run a support group, which is every 2 months, and taking a cue from the COVID experience, we've converted it online now. So we have a lot more people logging in, and it's beautiful because everybody shares their stories and they do problem solving together. So it's great, and there are many online groups as well. So there's a lot of support that is available today, and we live in a world where everything is easily accessible. So I think we're moving towards a better society in that sense.
Yeah, and I'm so glad to hear that you do these support groups as well, and that even in the kind of experience you're providing with your clinic, you have two amazing nutritionists who I know again, and you also have this kind of emotional support, and at the same time you take into account family, and I feel you're providing like a wholesome solution, not just focusing on one dimension of it, but actually giving rounded solutions to a problem and to a condition which has been not only neglected, but also stigmatized for the longest time. So thank you so much, Dr. Bhasker, for this session. I learned a lot personally, and I will go do more research because I just love doing it. But thank you so much for getting us started on this, answering all these questions really patiently, because I was really nervous you might just find a few of them a little stupid. But thank you so much for being so patient with it and answering them in this detail. Thank you so much to our audience, everybody who showed up, said a hello. Thank you so much for supporting us and Fugia Wellness in this journey. We will now see you next week. I hope you have a good day, good night, wherever you are. Bye bye.
Thank you so much, Anjali. Thanks a lot.